So glad to have you on this evening's webinar, 5-Step CS, Improving Case Acceptance for Periodontal Services. I am Wendy Briggs, and I am the president of Hygiene Diamonds, and we are an international consulting firm that helps hygienists and dentists know how to serve patients at a higher level. And this webinar is being hosted by Action and Henry Schein. So I'm super excited to welcome you tonight, and hopefully we'll spend some time together discussing a very hot topic. This is something I get asked about all the time. And, you know, the challenge that we have is there's so much material to cover in a fairly limited amount of time. But we're going to do our best. Many of you that are joining us this evening understand that periodontal disease is an oral manifestation of a systemic condition. We know that the mouth is not separate from the rest of the body. But for some reason, in recent years, it seems with traditional dentistry and dental hygiene, that many patients feel as if it is. Somehow it's not connected to their overall total health. Well, we know how serious the impact is of gum disease and periodontal infections in our country. The American Academy of Periodontology warns of a significant public health problem. And they state that half of American adults suffer from gum disease, and most of them are not aware that they suffer from gum disease. So if we look at that, it's 64.7 million adults that are 30 years and older that really have symptoms of periodontal disease, but many of these symptoms are not very obvious. You know, they don't have pain. They don't have, typical symptoms that they would have when they're experiencing dental problems. And this presents a little bit of a challenge for us as the dental providers because they don't come in with a problem. In fact, often we're dealing with patients that are unaware that they have a problem at all. And sometimes these patients can have advanced disease and still be unaware that they have a problem. So when we think about what's happening with gum disease, we know that gum disease is a contagious bacterial infection. Again, as we mentioned earlier, often has no symptoms. And if we look at the risk factors of the adult population, it's really quite remarkable how many patients are at risk in a significant way. They have a mouthful of risk. They may have poor hygiene. They may be smokers. Smokers are more likely to develop advanced gum disease. We know that periodontal disease is often a part of the aging process. As patients age, they can show signs of periodontal disease around multiple teeth. We know that there's a gender relationship. Female hormonal can affect gum disease. We've seen recent studies linking periodontal disease, actually it was just pregnancy gingivitis, with stillborn babies. So when we look at the results or the research, we often find alarming statistics about the realities of periodontal disease in our practices. Yet another alarming statistic is that dentistry IQ stated that less than 3% of all the codes utilized in dentistry are periodontal therapy codes. So there's a disconnect, isn't there? We have this overwhelming population at risk for disease, yet as a profession, we have a challenge and a struggle at getting these patients to move forward and accept the care they need. So when we look at why this matters, you know, we could cover hours of research linking periodontal infections to other serious systemic diseases. We know that bleeding gums can be a key early warning sign for more than 20 serious medical disorders, including diabetes, heart disease, cancer even. You know, the list of medical disorders, including that bleeding gums are a key early warning sign for, actually go on and on. I believe at last count there was more than 120 diseases that show symptoms in the mouth. So this is why these therapies are so important. We're really talking about reducing bacterial load in the mouth so that we can reduce bacterial load in the rest of the body and improve health in that way. And it used to be years ago, you know, when we'd see a patient present with plaque everywhere and bleeding tissues and redness, you know, we would jump on the oral hygiene instructions lecture. You know, they need more OHI, and we need to give them the Bass toothbrushing technique and angle the toothbrush just right. And I'm not saying that those things aren't important, but what I am saying is as a profession, we are recognizing that sometimes when we see disease and infection in the mouth, it really is indicative that there's other serious systemic diseases in the rest of the body. So more than ever before, science is proving the link between periodontal disease and systemic health. We now have the research and knowledge needed to address these underlying medical and nutritional issues that can cause poor oral health. So now when we see a patient that presents with bleeding gums, redness, sometimes slight bleeding upon, profuse bleeding upon slight touch, with these patients in today's world, we recognize that if they don't respond well to our periodontal therapy, what they need is not the flossing lecture. They need referral to a physician. So we're seeing more and more the challenges that our patients are having when it comes to their overall health. And I think we're becoming more aware of the symptoms and signs of these systemic health risks. And we are learning more about what we can do to impact their choices and the decisions that they're making on how they are going to handle these risk factors and what kind of therapy we need to provide as professionals to help them achieve better health. So as science progresses and science advances, we're learning a lot more about what's going on in the mouth. And I wish we had time to dive into the science of all of it because I am at heart a science geek. But we know now that we're dealing with a biofilm disease. You know, many patients, especially those that suffer chronic periodontal infection, chronic disease, we're dealing with a biofilm disease. And what we know about bacteria is bacteria will seek to come together for their own survival. And when these bacteria succeed in forming a biofilm in the human host, this is when the infection often becomes untreatable and develops into a chronic state. We see this with other conditions like chronic ear infections or pneumonia with cystic fibrosis, diabetic foot lesions. You know, biofilm diseases affect millions of people and cause many deaths every year. You know, with everything we know about wound care and healing, we should be able to heal that. However, sadly, if this is on a diabetic patient, they're most likely looking at amputation here because this has been classified as a biofilm infection. And once the bacteria has succeeded in forming that biofilm, the cells become more resistant to the body's own natural antimicrobial, natural defense mechanisms. They're resistant to antibiotics. I've heard it said 1,000 times more resistant to antibiotics. And we're also seeing in dentistry a similar trend in other areas of medicine that is somewhat alarming. We're seeing the overuse of antibiotics and antimicrobials that have contributed to the development of superbacteria. So the challenge that we have is we recognize that with scaling and root planing alone, it's just not enough. Bacterial levels return to pre-treatment levels within 21 to 60 days after scaling and root planing. That was published in the Journal of Periodontology in 2002. So we know that these bacterial levels return to pre-treatment levels, and if all we're doing is scaling and root planing, it really is in many ways like mowing this lawn and expecting things to improve. We've got to do more when it comes to the therapy side of our patients, and we'll talk a little bit more about that as well. What science is showing us about home care products and antimicrobials and things that we can do to really give our patients the best chance for success. So I think it's important to understand that we're dealing with some serious issues. You know, so when we talk about 5 steps to yes and helping improve case acceptance for periodontal services, we're really talking about more than that. We're talking about helping our patients fight disease and achieve a higher level of health than they would be able to achieve on their own. So let's go ahead and jump into that topic, because what I have learned over the years is often we are identifying and talking about periodontal infection with our patients. Dentists get involved in the discussion as well. Almost always, when patients don't move forward, we find there's a communications breakdown at some point. So our strategy, what we've taught over the last 18 years to dental professionals around the world, is to simplify the process. And that's what we're going to discuss here tonight. So the first step really is about using specific language before probing. We talk about step 1 as the need to probe correctly. And we're really not talking here about the angle of the probe in the pocket. We're really talking about how we message this and language this to patients before we begin. So when we talk about informing patients prior to starting what the numbers mean, they need to know what these numbers are. And I know many of us use this language already, which is wonderful. We're going to help just tweak some of the things that we're saying just slightly, because what we found when we do that, we can have a dramatically higher acceptance rate. Patients have a deeper understanding of the urgency of their situation. So that's what we're going to make sure that we discuss here tonight. And the other thing that we want to do is we want to verbally call out the findings. We want patients to hear these numbers. And sometimes if we find that we don't have anyone to chart pocket depths and we're in the room by ourselves, we often find that occasionally, you know, we're just writing down the numbers and we may not verbally call them out. I would challenge you to go ahead and verbally call out the numbers, even if you're in the room alone with your patient. It might seem slightly awkward, but they really do need to hear the numbers, the readings that you're finding in their mouth. So let's talk about the specific language that you can use with patients when you're doing your health assessment. So obviously, again, 3 and under is considered healthy. I know you know that, but they need to know that. We also encourage you to say a number higher than a 4 means there's infection. We have found an additional phrase to be incredibly powerful. And that phrase is a number higher than 5 means the infection has already spread into the bone. And what we have found is when you language it this way and you're dealing with a patient in the chair and maybe you're calling out 645, 546, 756, they really understand the urgency of their situation. So we want to keep it simple, but let the patient know we're going to do a comprehensive health assessment and evaluate the health of your mouth. We're looking for specific areas of infection. Just so you know what these numbers mean, and then you launch into this script. 3 and under is considered healthy. A number higher than a 4 means there's infection. A number higher than a 5 means the infection has already spread into the bone. What we have found is when you language the numbers this way in advance of your probing and taking your charting, patients actually turn to you when you're finished and say, we have a problem. And that's exactly what we want them to know after we do the record. Again, many patients present without symptoms. So helping them understand the urgency of the situation is really an important element of this process. So the second step is to utilize technology at a higher level. I find that many of us are using intraoral cameras when we're discussing restorative dentistry, but what we love to see is an embrace of technology, especially when we find periodontal infection. I found that patients really do need to see what we see, and technology has made this possible now more than ever before. And that's one of the reasons why I absolutely love this partnership with Acteon and Henry Schein. And we'll talk more about that in a moment, but the technologies that we have, I say this every time I'm presenting a lecture to dentists and hygienists. I don't think there's a better time to practice dentistry than today. We have so many amazing pieces of technology that we can use to impact patient experience and help us be more effective every single day. So they do need to see what we see. So here's some benefits that I found to visual patient education. 87% of our patients learn better visually. So we can be talking for the entire hour and the patient still may not get it. You know those patients, the ones we love to hear about when we've just gone through all the ins and outs of the infection that they have and everything we need to do, and they walk up front and say, hey, why didn't I have a cleaning today? Right? They didn't get it. Something was missing along the way. So 87% of our patients are going to get it better visually. The images help build urgency and provide proof. Proof of a problem, proof that something needs to be done. And as I stated before, the specific language during probing certainly helps build urgency, but the images are super powerful when it comes to building urgency as well. So we've also found that retention is much greater when we are providing visual education. So patients often will leave the office, they'll go home, they'll try to explain to their significant other or their partner what's happening and why they need more than they've had in the past. And sometimes it gets lost in translation. What we have found is when there's visual education that occurs, the retention of the why is much more powerful. They understand why they need to do something different when we are using visual education. So when we look at all of those benefits, you know, we look at a lot of different reasons how we can use technology. Another compelling reason for using visual education is for documentation. Now, many of us are aware of the new code available for this year, 4346, and that's scaling in the presence of gingival inflammation. And one of the things that we have found with submitting this code to insurance and trying to get reimbursement for this code is the need for enhanced documentation. So you can see here the lower two images are really examples of what you can do with your camera on daylight mode, especially to help document the findings that you see. Obviously, with advanced periodontal disease, the camera is going to be helpful, certainly for patient education, but it may not add a lot that's missing to the puzzle for insurance companies. The lower two images are incredibly powerful when it comes to submitting claims to insurance companies. You know, I have found that insurance companies are becoming more bold, and they are almost blatantly denying claims for services that our patients desperately need. Well, if that's happening to you, you can utilize your cameras to help you provide additional documentation to get you paid for the services that you deserve to be paid for. So I love sticking that probe into that bloody pocket. Take a picture of it. And when you include that with your insurance claim, your chance of denial or refusal dramatically shifts and changes. And we'll talk more about that as we go throughout other images. Powerful. So you can see here's some ways for you to use an intraoral camera on daylight mode or a regular intraoral camera to help with documentation, to help build urgency for the patients that you're serving about the services that they need. We love to see you using your cameras in more ways than that. You know, why not celebrate the patient's accomplishments? Show them this is what your tissues look like before we began this therapy, and look at the progress we've made. I think we can all agree that there's been tremendous progress with this patient's health. Are they perfect? No. Is there still room for improvement? Sure there is. But we've made tremendous progress. And I think it's very powerful when we can use our technology to celebrate that progress and help them see how far they've come. And again, we're trying to motivate and inspire continued behavior. What gets celebrated gets repeated. So that's another powerful way we can use those cameras. Now let's go ahead and take a minute and discuss the SopraCare and the amazing technology that Acteon has put together. As a hygienist, myself, the first time I saw this technology, my mind was blown. I was asked to speak at the Yankee dental meeting in Boston a few short months later, and I was asked to speak on 5 pieces of technology that I thought every dental practice should have. And I can tell you that the SopraCare camera made my top 5. Because we have one device that can actually do a variety of things for us. It has a daylight mode, so you could use it, you know, in this instance, like we said before, showing the patient how they're doing with their home care. But we can also use it in a different mode, a different wavelength of light, called a perio mode. And so we're going to talk about that in a moment. So I'm really proud to be partnering with Acteon. My company, Hygiene Diamonds, we are the recommended for all of Acteon in helping with the I Promise movement. So we are helping enroll dentists and hygienists to take a pledge to fight against periodontal disease. And in the perio mode, this technology, this camera, can actually highlight both daylight mode, but in the perio mode, we can highlight plaque, calculus, and gingival inflammation. So I want to show you what a powerful tool this is when we're talking about visual education and visual tools to educate the patient. Now, those of you that want to know how it works, it's a very specific wavelength of light. And the wavelength fluctuates between 440 and 680 because of the white LEDs that function. And again, I'm not going to get into too much of the science of how it works. All I can tell you is that it does, and it's incredibly powerful. So for many years, we can recognize the early warning signs of periodontal infection in our patients, but they can't. You know, we mentioned earlier how often patients come in without a clue that there's a problem. They really don't understand the symptoms that they have. and the challenges that that can create for them in the future. But when we turn on the SoperCare camera in the perio mode, it's powerful what happens. Here's an example for you. In this case, we can see that tartar, we can see light gingival inflammation, and now in the perio mode setting, the patient can see it as well. So I'm sure you can understand how powerful of a tool this is, especially in conjunction with all the other steps we're talking about. What a powerful tool to be able to show the patient what we see. Hygienists and dentists on the webinar tonight, you can see the plaque there. You can probably see the tartar. You can see the inflammation in this picture. But the patient may not be able to see it at the same level until you flip on perio mode, and now they can see it. So it's an incredible tool that helps us better discuss with our patients what we see. They can finally see what we see. And I can show you case after case after case. Recognize what a powerful asset this is in our practices discussing disease, periodontal disease with our patients. Wow, right? I mean, I love being able to equip our hygienists with tools and technology that can have an impact in their practice. So the perio mode is just an incredible addition to an already effective hygiene protocol. But what's really exciting about this is that because of the support of Acteon and Henry Schein, the partnership with Henry Schein, when you take the pledge, dentists and hygienists, you save a considerable amount of money on this technology. So we're super excited to announce that. And again, I've been excited to be involved in this incredible project. And not only do you have the SoperCare with the daylight mode, the caries mode, and the perio mode to help you educate and inspire your patients to move forward, they also provide, when you take the pledge, with an incredible amount of tools and resources to help you incorporate the technology as well as the protocol that you want to utilize when you identify and classify the patient. So when we take the pledge, we're pledging to detect, diagnose, and treat periodontal disease at a higher level than we may have in the past. So this entire process is just really a tremendous asset for every dental practice to have. So if you're not familiar with taking the pledge, you can find information about that by visiting www.fightperiodontaldisease.com. And that's where you can take the pledge. And Acteon has partnered with Henry Schein, as I have partnered with Henry Schein. I'm proud to be one of their business solutions partners, and we are one of the select few consultants that Henry Schein recommends. So that's how we are able to provide, that's how Acteon and Henry Schein are able to provide the SoperCare technology at such an incredible price point when you take the pledge. So again, for those that are interested in more information about the technology as well as how to take the pledge, that information is there for you. So the third step is to review the findings with the patient and to fill out the assessment form. One of the things that I can tell you is that too often we are working with practices that have multiple providers under one roof, but more commonly today we're working with organizations that have multiple practices. So one of the challenges that they have is to find out and have a systematic process that everyone will follow. And here's what we often see. We sometimes see that a patient may be seen with one hygienist in one treatment room and be told one thing. And then naturally, it's not uncommon for us to have a varying level of diagnostic assertiveness or different backgrounds or different experiences that guide our decisions, right? A patient could be seen in the same practice for a hygienist and be told something else. So consistency is really important when it comes to periodontal assessment and protocol. And again, it's very common for dentists and hygienists to not quite see eye to eye. It's common for hygienists that work with the same practice to not see eye to eye. And so how can we create consistency? Well, one of the ways that we've done that is to have a health assessment worksheet that everyone fills out. Okay, this is an example of how when we were first educated and trained in school, they had assessment worksheets for us to fill out. So here's a way that we can kind of go back to that so that we're all following the same process and we're using the same formula to assess our patient's health. So when we look at that, what does the periodontal health assessment worksheet look like? Well, we've created a fairly generic version that we help hygienists and dentists implement all across the country. And it looks something like this. So when you're making an assessment, you're looking at more than pocket depth. You're looking at more than calculus deposits and bleeding and tissue appearance. We're really giving the patient a score of all of those things added together. Okay, and at the end, you're going to have a total of all points. And this is just an example of one practice and what they do based on the severity of what they see with their patients. And again, in the fine print on the bottom of this form, it actually says this is not intended to be a diagnosis in any way, merely a guide to open conversation so that the dentist can make a final diagnosis. So that's an example of how we create consistency. So that's the third step, is to review the findings with the patient and fill out the classification worksheet. From there, we begin the conversation with the patient. Now, I had a question pop up, and I want to handle that question really quickly. And the question was, what is the cost for the Acteon SopraCare intraoral camera? And I can tell you the answer to that question really varies depending on where you are in the country. It varies based on your practice scope and size. But when you take the pledge, they will contact you and let you know the optimum price point for your area. I believe it's around $3,500. But again, I do not work for Acteon. I am not a representative of Henry Schein in that way. So I am not 100% clear on the price point. I can tell you that even when they were, before this special offer came about, they were about $6,000 is where they began. And I had practices purchase them even at that price point because of what they bring on the return. So there was one quick request as well to go back so that she could see the points as an example on the worksheet. Now again, the worksheet is not complete. When I show you this health assessment, there's pieces of this worksheet that you can't see. And I think the reason for that is, we've got to be careful not to have a one-size-fits-all solution when it comes to some of these things. And that's why it's important to really take into account practice philosophy and, when your doctor feels like it's an ideal time to move forward on periodontal health. So again, we've got to be careful. I'm giving you these forms as an example, and these are things that we help practices implement, but there does need to be a certain level of customization occasionally when it comes to these forms. So I'll share with you before we're finished here how you can have access to some of these materials as well. Okay, so the third step then is to review those findings with the patient and fill out that classification form. We often begin that conversation by saying, let's talk about where you are. To treat this infection, we need to do 3 things. Okay, so I'm going to walk you through again. We try to simplify this process because we know that the patient has to be 100% clear, and if they're confused, they become frustrated and they don't move forward. So they need clarity, and we have got to work hard to simplify our thinking and simplify our conversation. So the first thing we need to do is we need to do a gum infection therapy, a more advanced treatment than you've had in the past. That's the first thing we need to do. Okay, so for many of us, we might use an analogy of a splinter under the skin. It's kind of like having a splinter under the skin. Until you remove the source of the infection will never be able to heal correctly on its own. And I know many good hygienists use that analogy, and I think it's a great analogy. I think it's a great way for patients to truly understand what we're talking about when it comes to clearing up this infection. Okay, the second thing we need to do is we need to change a few things that you're doing at home. Now, here's one of the things that I think we all need to understand and be very clear on. Patients hate being shamed or guilted when they come into the chair. Sometimes we may feel they need it, but they hate it. And if we think about it, what really is our long-term goal? Our long-term goal is to retain our patients. And the last thing we want to do is
have them feeling guilty or shamed for not doing what they need to do at home. I'm going to be honest with you. When patients are not doing what they need to be doing at home, they know it. And they know that we know it. So instead of focusing on what they're not doing, we prefer instead to focus on getting them better tools. Introducing a prescription strength microbial mouth rinse, introducing a power brush of some kind, really truly equipping the patient with everything they need to succeed. So let's take a few minutes and talk about a few quick tips for you on getting them better tools. I love a power brush analogy. We talk about a power brush being comparable to a manual screwdriver or power screwdriver. And once we start seeing early signs of infection, the patients really do need to understand that it takes tools to get the job done at this point. You know, we've got so much bacteria in the mouth that we've got to reduce the bacterial load, and the best way to do that is by providing them with power tools. And we do this in a fairly effective way. We will tell patients we have a variety of power brushes here at the office as a service to our patients, because we can provide them to you for less than you'll pay at Walmart or Target or Walgreens or whatever. And what I would suggest you do is you find out which brands of power brushes you can carry and stock in your office that you can provide the patient a few dollars less than they'll pay at Walmart or Walgreens or Target or something similar in that way. Now, we're seeing a wide range of brands out there, and people always say, Wendy, you know, what's your favorite brand of power brushes? And I can tell you, you know, Sonicare's got a great brush, but they don't have a very good price point. Oral-B has a wide range of good brushes at better price points. I've been impressed with a new player in the marketplace, Dentist RX. They have some great brushes at a great price point. So I think, you know, realistically, they all are far better than a manual toothbrush for our patients. And what you need to do is you need to investigate, you know, what fits your budget, what fits the patient's budget, and provide a wide array. I will often tell patients we have to the Lex, where do you want to start? And we allow them to, you know, kind of decide what best suits their budget. And like I said, any type of power brush is going to be better for the patient than a manual brush. Okay, so a couple things I want to about antimicrobials. There are so many studies that we could review about this. In fact, we could do a 3-hour training just on antimicrobial agents, but we don't have the time for that here today. But I do want you to understand that there's been some incredible science that has shaken up our industry in recent years, and some of you may not be aware yet of this science. So numerous studies show clinical benefits of adjunct home care products, especially where they need to compensate for deficiencies in mechanical hygiene skills. So brushing and flossing, where that's not ideal, we want to introduce toothpaste and mouthwashes containing active antimicrobial agents, but we also need to be careful about what we're introducing to our patients. So chlorhexidine has been the gold standard for so long, and I think one thing that I have found over the years, you know, personally, I'm just going to be honest with you, I haven't used chlorhexidine in more than 15 years. I've always hated it. And I think many of us that do use it kind of hold our noses when we recommend it because we don't love it as the hygiene providers. Staining, tartar formation makes our jobs harder, but also patients don't love it. Compliance is poor. But we've known that it has, you know, broad antibacterial and antifungal properties and has for years. But now we're starting to see some studies of tolerance with specific strains of bacteria. So tolerance levels are higher when microbes grow as biofilms. And so this research was published in October of 2014, talking about chlorhexidine tolerance and biofilms. And to the knowledge of these researchers, this was the first report of tolerance to a broad spectrum biocide such as chlorhexidine. So they found that they really don't understand why the bacteria is tolerant, but they are tolerant. They've induced changes to their own structure as well as the structure of their DNA, basically. And so now the entire species, the entire strain of bacteria has become resistant and tolerant to chlorhexidine. That's important for us to know. So other inconsistencies that we deal with is, wouldn't it be awesome if we had a way to reduce bacteria, not just the bacteria that's causing inflammation and infection with periodontal disease, but also to reduce the bacteria that that causes cavities. Well, chlorhexidine has never had an impact at reducing strep mutans. So that's something that's important to know as well. Now, another thing that was alarming with this study, another study in 2014 showed chlorhexidine demonstrated cytotoxicity and subsequent cell death. So when we're looking at why we're using chlorhexidine, we're trying to give our patients products that can reduce the bacterial load, yes, but we also don't want to give them a product that can interfere with their healing and new cell growth in those areas that have been diseased and destroyed. So I am finding many good dentists, hygienists, many periodontists now are not utilizing chlorhexidine in their practices at all. So then I have hygienists look at me in a panic, with panic in their eyes, and say, oh my gosh, well then what do we use? Well, Dr. Sam Lau, a renowned periodontist at the AOSH meeting just last year, said he's using essential oils in his practice. And we don't have time to get into this, but I'm a huge fan of a product line, Essential Smiles. I was actually involved in helping create this product because of what the science was showing us. And we don't have time to get into the science of this. Again, I could spend a whole nother 3 hours on the science behind this, but I would encourage you to do some research, do your own research. And if you'd like to register for a free webinar about the science behind Essential Smiles, you can do so by visiting that website. So the key is we want to give our patients products that work. And before Essential Smiles came into play, I was using a lot of other products out there, 0.64 stannous fluoride rinses. We would use, tooth and gum tonic, for example, is another essential oils-based, natural-based product. The key with Essential Smiles is it also provides a therapeutic dose of xylitol, which is a known cavity fighter. So I really don't care what products you use, but I would encourage you to look beyond the norm and dive into the research about bacteria and biofilms and how we can have an impact on those bacteria at a higher level than we may have by using traditional products such as chlorhexidine. So the other thing that we talk about, so we talked about the first thing we need to do is to do a gum infection therapy, more advanced treatment than they've had in the past. The second thing is we need to change a few things that they're doing at home. The third is we need to see you back more often, and things will be different from now on. This is so important to clarify from the very beginning, because how many times do we find ourselves in a unique circumstance months later where the patient says, hey, that periodontal maintenance that you're wanting me to do, I don't need all that. Can't I just have the regular cleaning? Can't I just go back to the regular cleaning? Or we may have patients that ask to alternate between the maintenance code and the cleaning code, and we know that that's not advised as well. So it's really important from the very beginning to make sure the patient has a deep understanding of the fact that we need to see them back more often, and things will be different from now on. They have been diagnosed with a disease. And this is much like arthritis or diabetes, where now that they've been diagnosed, they'll have it for the rest of their life. We're going to partner with them and help them keep it under control and do our very best to minimize consequences or damage from the disease. But things will be different from now on. It's important that they understand that from the very beginning. And a great analogy that some use here is the oil change, right? You can have a brand new car, but if you don't change the oil every 3,000 miles or every couple of months, that new car is not going to last you very long. So the patient does need to understand that we've got to maintain in a timely manner so that we can keep that bacterial load under control long term. So the next step is to review the findings with the Perio brochure. So this helps customize your recommendations for them specifically and helps them get it. And this is an example of what this tool looks like. And I'm going to give you a number to text here in just a moment to get a digital copy of the most current recent version of this brochure. But this Perio brochure actually gives the patient an introduction to what's going on in their mouth, why we're looking and why we're doing this health assessment. It tells them where they are. So even if they're healthy, we actually recommend you use this with patients as almost like a report card to let them know, hey, we did a health assessment, everything looks good, that's why you come every 6 months, way to go, keep it up, because it's a natural part of the aging process. At some point in your life, you may start to have some challenges, and we might start to see some deterioration in your mouth.
So you can go through and give them a specific example of where they are. And then you can see on the right side of this brochure, you can also check off any treatment recommendations that you think they need. So it allows you to personalize the recommendations for those patients. Okay, so again, what we do and why. Definitions, the home care recommendations, all this is included for you on this resource. And I want to give you some time to write this number down because you may not be able to send a text immediately. If you do happen to have your cell phone handy, it's a very simple way for you to get an instant delivery of this resource. All you need to do is text the word perio to the number on the screen, 855-999-7124. Okay, so just text the word perio to that number and you will get a text back that asks for your name and your email address. And then you will actually get another text back that asks permission for the file to be sent. That has been the fastest way that I can share some of these resources with you. So I'm more than happy to share the copy of the Perio brochure to give you an idea of what you can create. Many practices just use it as it is. It's fairly generic. And you are welcome to use it as it is. It's not as common that we need to adapt that and personalize it as we do some of the other resources I've discussed here tonight. So I've stayed on this slide for quite a while so that hopefully everyone was able to either send the text already or write that number down. The number one last time is 855-999-7124. So, review the findings of the Perio brochure, that's step 4. Step 5 is finding the money. Okay, now obviously hygiene providers, typically this is outside of our area of expertise. But the reason I mention it is because sometimes we feel like the patient's all in, yes, 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 and then they get the financial treatment plan and everything goes out the window. So one of the things that I have found is when you follow these steps, when you probe correctly and you help build urgency with the words that we use, when you do visual education, when you show them the total classification and their score and what that means, and then when you go over the findings with the Perio brochure, they understand that this is a lot more involved than just a cleaning, right? Sometimes I feel like after our Perio discussion, before we introduce these steps, the patient had the perception that it was like driving up at a car wash. Do they want the basic or the supreme? But this helps them understand that this is a lot more involved than a simple cleaning. So when we get to the point where we're discussing the money, when they ask how much it costs, what they're really asking is, how can I pay? That's the question they want to know. Okay, so finding the money is an important part of it. And again, we could do a whole nother webinar on that, you know, financial conversations and powerful conversations and how we can help patients find the money. But hopefully we have some talented people on our team and we've got a good process in place for financial conversations because that's an important element as well. We've got to help the patient be able to comfortably fit in their budget utilizing outside financing or some way so that they can you know, fit it into their monthly budget. That's an important thing that we need to be focused on providing. Okay, so what if after all this, the patient still just wants the regular cleaning? That's an important question. I can tell you that if you follow the 5 steps that we've outlined tonight, you're going to have fewer circumstances where patients decline periotherapy and just want the free insurance cleaning. That's going to happen more rarely. It probably still will happen. And so what do you do when that happens? It's really important. Here's a screenshot of a social media discussion. And what I want to call your attention to is the paragraph in the middle. And this is a hygienist that said, I worked for an office that did a regular cleaning on a perio patient. After informing the patient, documenting the patient has perio disease, and that patient went to another dental office 6 months later. They denied them any cleanings except the scaling and root planing. And the patient said, well, my last office did a regular cleaning. The new office said, you could sue. They did and won. True story. So it's really important for us to know exactly what we're going to do if they don't move forward. Okay, so that's a really important element, a really important part of it. So for the patient declining periotherapy, we have to recognize first and foremost that they are a liability to the practice. Records are critical. We must document everything. And that's why having a SOPR Care camera is an important part of the conversation, because if you document from the very beginning what you see and why they need more, you're going to be better protected as well, if, heaven forbid, you find yourself in a court of law at some point. Okay, and we've got to prepare for that. We live in a very litigious society, and sadly, very good dentists have find themselves having to defend themselves in court. Okay, so when you document everything, that's really important. Use your SOPR camera in the perio mode and document those images. That will help protect you. No prophy should be done. Okay, that's really important. And I understand some people go ahead and do prophy because that's what the patient wants, but we will put the patient in a holding pattern for a time. Okay, if they're in a holding pattern, the correct code to bill is 4355 or gross debridement. Now I know that insurance companies sometimes don't pay as well for this code as a prophy. That's not your fault. The point is, you cannot use a code that's destined or designed for a healthy mouth when the mouth is not healthy. So our philosophy has long been to code out a 4355 and put them in a holding pattern for a time. Okay, so a waiver can be signed, but it will not hold up in court. Okay, so again, you've got to just get clarity on what your doctor wants you to do in that circumstance, and make sure that you're protecting yourselves, because it's the doctor's license at risk, but it's also your license at risk. So be very careful what you do. And we will allow the patient to be in a holding pattern for a time, but eventually you have to land the plane. When they put you in a holding pattern and you're in the air, it's typically because conditions aren't quite right yet on the ground. So we usually will put the patient in a holding pattern for about a year, but after that, the patient is dismissed from the practice if they're not willing and able to move forward on the necessary treatment at that point. Okay, so that's important for you to understand. You know, you just need to understand what your practice philosophy is if the patient continues to decline periodontal therapy. So here's a quick summary for you, a quick summary of the systems that I've just gone over with you today. 5 steps for periodontal success: probing correctly, visual tools and cameras, building value, the periodontal health assessment, 3 things we need to do, better tools, back more often. All of that is summarized in this quick infographic. And this is an infographic that is readily available on our member website, along with a lot of the other resources that we talked about here tonight. And I recognize that on a webinar, it's such a short amount of time, and it somewhat feels like I've been able to cover just the very tip of the iceberg, right? So there's so much more to the puzzle, but I wanted to give you at least some things that you could take back and apply right away in your practice. For those of you that are wanting more information and more knowledge, you can go and register for a copy of my book, a book that I wrote on practice growth. It's the ultimate guide to doubling and tripling your dental practice production. And there's more information in there, more insights about what we do and how we do it. So we have just a few quick minutes left, and there's been a few questions pop up. So doubleproductiontoday.com is where you would go to register for that free book. And there was someone who asked if we could post the 1-800 number one more time for texts, and I certainly can do that. Let me just pull that up, and I'll read that out loud in just a moment. In fact, I'll just flip back to that slide here in just a moment. Another question was, how can we recommend get information on the Essential Smiles? You can go to the essentialsmiles.com site, and if you scroll down, there's a spot that says Learn More. And you can put in your name and your email and the best phone number and submit that. So just continue scrolling down. If you're looking on your mobile phone, it may be that you just didn't scroll down far enough. You can request Learn More, and at that point, you will receive an email with an opportunity, a contact information to request the scientific review webinar. Okay. So another great question is, when do we refer to a specialist? And that's a great question. And I would say, you know, often that's not a one-size-fits-all answer. It really depends on the scope and the skills of the hygiene team and the treating doctor. With laser technology, some GPs are doing tremendously good work with periodontal therapy. So that is not a one-size-fits-all answer, but I would say, you know, initially we will refer to a periodontist in our practice We typically will refer if we're not seeing good results after the initial scaling root planing at that first 4-week follow-up. We often will refer to a periodontist and a physician at the same time. Keep in mind, this is representative that there may be an overall health problems. And so we want them seen by a physician as well. So I would say, that's a great conversation, a question to ask your doctor is, when they would like you to refer to a specialist, or if you have a specialist that you're confident in their skills. Some practices have a specialist on staff. So that is something that, that you need to discuss with your team. Okay, let's see, there's another great question, and that is, do we do any pro fees over the year they're in holding mode? Great question. What we typically teach is to continue doing a 483.55. Every time the patient comes in, we cannot code. My understanding of the pro fee code is that this is only to be utilized when there is health. So we currently do teach that we have patients enrolled or receive a pro fee when they need more advanced therapy. We just don't think it's worth the liability. Okay, so if the patient comes in for an exam and pro fee, how can we go to debridement code? Again, you have to look at the limitations that you have in your state. You also need to look at, this particular patient individually. If they have come in for a comprehensive exam, sometimes that has to be billed on a day other than the debridement. So, again, there's no way I can walk you through all of the protocol that we teach. There's a lot of complex questions. So I'm going to try and focus on just the very specific questions that we can answer today. So a really great question was, how about an email rather than the text number for those who are not proficient with texting? That's great. You can email support@hygienediamonds.com. And I'm trying to get back here to the page. Oh, and I think I may have already passed it, where we actually talked about the brochure. There's the number as well. Okay. So another great question is, can we refer to a specialist for non-compliant patients? And I would say absolutely, because that covers you, but you must, again, you must document, because if you refer a patient to a specialist and they choose not to go, but you have not documented that appropriately, you can still be held liable. So I think in a way, we've got to be super careful. Documentation, 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 which is another tremendous advantage to having the SopraCare camera. And that's also an important question. Okay, another question was, what are my thoughts on Arrestin? Great question. So here's the thing. We teach cutting-edge periodontal therapies, which means we are laser clinicians. And I think before we had lasers, that we were able to utilize to reduce the bacterial load significantly in the pocket, Arrestin was a great option. But I'm more cautious about Arrestin now, especially given the research on superbacteria being tolerant and resistant to antibiotics. If we're dealing with Bacteria biofilm, remember it's 1,000 times more resistant to antibiotics. So I think in acute infection situations, Arrestin does make sense, but I certainly don't agree with the philosophies of practices that are placing 30 and 40 sites of Arrestin in one thing. I think that is I think that's gouging patients, and it's not fair. I much prefer hitting all of those sites with a laser. I think that's far more patient friendly, and the results are proven more powerful as well. So I got another great question, what is a holding pattern? Okay, so I probably didn't clarify that very, very completely. A holding pattern, occasionally when you're in an airplane and you go to land the plane and the conditions on the ground are not right, they're not safe, or they're not ready for you yet, they put the plane in a holding pattern. And what that really means is we know that a full mouth debridement is not what this patient really needs, but a prophy isn't what they need either. So holding pattern, in my definition of that is we are doing our best to compromise and treat the patient temporarily until the conditions improve, until we find the money, until they go from a place of skepticism to one of acceptance. We're going to put them in a holding pattern for a time. Okay, so let me see, we've got some other great questions. One was, what about the water pick? I've seen great results. We love all sorts of home care tools. I'm a huge fan of the water pick. There's a lot of things that we just didn't have time to talk about. So again, find what you love and find what's working for your patients and just help them see the vision and the value in investing in some of those tools. We certainly don't have time to talk about all the home care tools because we just only had a short amount of time together. So another great question that came through about, what about states where hygienists can't use periodontal lasers yet? What do you recommend for antimicrobial treatment? Well, in some of those, hygienists may not be able to use these lasers for what's called laser sulcular debridement, but they can use the laser with an uninitiated tip for bacterial control. So I would encourage you to find out what the rules and laws are for your state and find out what you are able to do. In those circumstances, if we're dealing with an advanced periodontal therapy patient, it certainly is, in my opinion, a great strategy to have the doctor step in for just a few minutes to utilize the laser. It adds revenue to the appointment, but it also helps the patient heal and grow far better than not utilizing the laser. Okay, so the question, another great question is, do we prescribe oral antibiotics for initial infection or ANUG? And I believe that the protocol on this is Periostat is now recommended at initial diagnosis for advanced periodontal disease for 2 weeks, and sometimes, depending on the patient's healing and resolution, it's advised to do the Periostat regimen once per year going forward. So really, I think, again, that really depends on how the patient has progressed, but certainly in acute infections, it's very different than chronic infections. So, you know, I certainly see value in antibiotic therapy in acute infections, but what we have to be careful about is not going over the top in chronic infections. Okay, so another question that came through is, what is the difference between regular prophylaxis and periodontal maintenance cleaning? That's a really great question, because I think patients have the same question. They perceive that, you know, the prophy and the peri-maintenance are pretty much the same. So I think this really is an important thing that we discuss in detail when we are working with hygienists. We talk about how we have a need to differentiate between a perio-maintenance service and the prophy. So the perio-maintenance service, we're certainly doing a lot of things differently. But we also need to communicate with the patient what we're doing differently and why we're doing it that way. So we have a whole list of items, and we just don't have time left this evening to go into the things that we do to differentiate. But a lot of that is just how we talk to the patient and what we tell them we are doing. Okay? So many great questions, and I apologize that we just haven't had time to get to all of them tonight. We're running out of time. We have less than 2 minutes left. So I just want to give a few more tidbits of information. You can go to Double Production today, request a free copy of the book. You can also go send your text or send an email to support@hygienediamonds.com to request a copy of the Peri brochure. And then the other thing that we want you to do is go to fightperiodontaldisease.com as well to register and take the pledge. So with that said, it's been an absolute pleasure visiting with all of you tonight. And we would love to hear from you one way or another. I'm hoping that you take the time to register for a copy of the free book. You can come visit us on social media. If you have any other questions that I did not have to get to tonight, I'm also going to give you my email address. You can email me directly, wendy@hygienediamonds.com. And I'd be happy to answer the questions that you have that we didn't have time to get to tonight. But I want to thank you for attending our webinar. I want to thank Acteon as well and Henry Schein for sponsoring this evening's webinar and for working so hard to get us, dental professionals, the technology and the supplies and the resources we need to really help our patients. Again, in my world, it's never about the production. It really is about doing the right thing for the patients. And I have found that production is what comes when we do that. So production is never the goal.
But production is the result that we find when we serve our patients at the highest possible level. So again, thank you so much for joining us tonight. I hope you found some valuable information that can help you. And of course, to get your CE, there will be a quiz follows. So thanks again for joining us this evening, and have a wonderful week.